It's made in a lab to mimic a vitamin essential for cognitive health.
10 super key signs that you are deficient in vitamin B6.
In its manufactured form, too much B6 can cause life-altering issues.
I had to give up work. I couldn't use a keyboard. I could not type.
It just seemed to affect every bit of my body.
I literally thought I was dying.
In early January, 7:30 broadcast a story about dietary supplements. And since then, we've received dozens of responses from right across the country. People of all ages telling us about cases in which they'd inadvertently poisoned themselves from consuming too much of the synthetic vitamin B6.
Stay with me.
Carrie McInerney is an award-winning singer-songwriter whose career was put on hold after 4 years on supplements.
I had started a program which was for weight loss, and it was protein shakes, and it was also vitamins. There was a whole package of vitamins that went along with it.
As Carrie's career progressed, she began to notice some odd symptoms.
My legs went numb. I began then getting numbness all the way up top of my body, right to my neck. There were times in bed that I actually couldn't move. I became paralysed, literally paralysed.
Unknowingly, she'd developed peripheral neuropathy, a side effect of B6 toxicity.
Had a very, very bad night's sleep.
It damages the nerve endings in limbs. The worst cases have been irreparable.
Just felt my entire body from here down was just all numb.
Carrie was eventually admitted to hospital.
They did the test. One of those was the B6 test. When I got the results back, it was 1,140 high. The protein shake and the kit that I was taking, I was actually taking 12 times the daily safe amount.
Associate Professor Joanna Harnett explains B6 is added to help the body absorb supplements like magnesium. What happens when we have too much B6 in our system?
The major concern that has emerged has been this issue around something called peripheral neuropathy, which is a toxicity to the nervous system where people experience symptoms of like pins and needles or sensory changes in their hands and their feet or their extremities. And in more extreme cases, it can affect the way somebody walks.
So what's the recommended daily intake for B6?
1.3 to 1.7 milligrams per day.
Yeah. I think what's confusing a lot of people then is why supplements, for instance, like this one I have here, which is a B6 supplement, says it has a total B6 dosage of 100 milligrams.
It's not uncommon when treating a deficiency to use larger doses, but I think that's the key difference here, is treating a deficiency compared to regular supplementation where there is not that need.
For instance, this is a magnesium supplement, and so someone who has a magnesium deficiency, for instance, might be taking this not realising that they're taking these high-dose B6 as well.
Mm-hmm. Correct.
Kelly, what happened to you?
Horrible symptoms. I had numbness. I couldn't work for 12 months. I lost heaps of weight, lost hair. It was just horrendous. I had no awareness. I was taking a multi-B. I was taking high-dose magnesium. I was also taking a multivitamin, plus eating lots of high B6 foods. Had no idea.
As the COVID pandemic took off, Paul Teresi wanted to boost his immunity.
So I was taking a multivitamin. It was the one a day. I was taking a zinc plus and a magnesium, the zinc plus, the plus is vitamin B6. I was getting burning sensations, tingling, pins and needles. I ended up with a lot of muscle loss. So we got a blood test and the results come back. I'm 7 times the normal sort of range for vitamin B6.
Ellie Karu inadvertently took B6 after 14 years of managing Parkinson's disease.
And suddenly I got a whole raft of symptoms, including burning sensation in my toes, my feet burning at night, burning fingers, insomnia. I lost a lot of weight, 5 kilos just dropped off me.
She suffered with symptoms for 2 years before a GP friend discovered she had 6 times the safe level of B6 in her blood.
Well, I didn't even know I was taking it. That's the, very frustrating part. I was taking some magnesium, not every night, but, on occasional, a few nights a week for some time. And it turns out that also had 50 milligrams of vitamin B6.
Bill Piggot's a retired physician who worked for the World Health Organization. He went to his doctor for testing after developing peripheral neuropathy symptoms.
It came back 6 times normal. So the thing had it on it in red, pyridoxine toxicity.
Could you believe when you were told that you were poisoning yourself?
I just believed that if it was a water-soluble vitamin and I was taking too much, I would pee it out. No. I retained it.
In 2019, Karen Delan could no longer endure the numbness in her feet and arms. After a week in hospital, she ended up at her local GP.
So I went to her and first visit, bang, she did B6 toxicity. Straight away she found out. So I don't know why the neurologists in the hospitals and all that didn't know. After I found out that I had it, I went through all the tablets we had here, and there were so many that had B6 in them that you wouldn't have known, unless you sort of read the fine print and someone warned you.
In 2022, the Therapeutic Goods Administration strengthened regulations, requiring a warning about peripheral neuropathy on products containing more than 10 milligrams. It also reduced the maximum permitted daily dose of vitamin B6 in listed medicines from 200 milligrams to 100 milligrams.
We don't really have any good numbers of how much of this was happening before the TGA intervened and what sort of response that's had. Having said that, I do know that there are some clinician bodies that are suggesting to the TGA that it needs to be lowered again.
GP and dietitian Dr. Terry Lynn South has noted an increase in cases of people accidentally taking too much B6, which is often listed on labels as pyridoxine, pyridoxal or pyridoxamine.
My sense is that clinical vitamin B6 toxicity is underreported, and the reason for that is the symptoms of the peripheral neuropathy can be explained by a number of different medical conditions, and it's only if the clinician thinks to test for vitamin B6 would that become apparent.
The TGA told 7:30 it's considering tightening regulations but is waiting on advice from experts in the field. Supplements are big business, a sector worth billions of dollars in Australia. Many of the major manufacturers and companies are members of the peak body, Complementary Medicines Australia. Considering the number of people coming forward with complications from B6 toxicity and the high likelihood it's going underreported, has the industry considered doing more to address the issue instead of waiting for the TGA to tighten regulations?
So the TGA has already put requirements in place for products that contain more than 10 milligrams. There are warning statements on the label to highlight possible side effects that consumers should be aware of. But these products are medicines. In Australia, vitamin and dietary supplements are regulated as medicines. And like all medicines, it's really important that consumers understand the product that they're taking and they understand and make sure that it is correct for their healthcare needs. That's why if consumers have any doubt at all, they should reach out to either the company that produces the product or their healthcare professional, or in particular, their pharmacist.
I don't think that really answered the question. The question's more so, it's a really big industry with a lot of capability. I mean, you spend a lot of money on marketing and advertising. Is there any more that the industry can do to make it clearer to Australians that, hey, be warned, if you have too much of this stuff, you can poison yourself?
We work really closely with the TGA when it comes to safety issues. Just as they may raise safety concerns with us, we raise safety concerns with the TGA as well. At the end of the day, we work together to try and achieve good safety outcomes for consumers, while also ensuring that people have access to the products that they want to improve and support their health and well-being.
What should other people know about this?
Analyse what you're taking, do your research in the vitamin B6.
The medical fraternity really needs to be educated.
Everybody needs to know that these things can be quite dangerous for you.